From a health perspective, there's a couple of areas that we spent a lot of time on. One is actually mental health, where we have found that there is a lot of issues that need to be addressed in the system today. From a cultural standpoint, the good news is that culturally, I think we've come to understand and accept the need for improved mental health. And in fact, we find overwhelming support from employers recognizing how important the mental health of their workforce is to their business and to their health strategy. But from a system standpoint, it's actually getting worse. Some of the issues that we're trying to address are issues around network access. Many professionals in the behavioral health space are not practicing in networks. While we may have a lot of providers in the system, in the directories, most of those providers, or many of those providers, are not taking new patients, or to get an appointment takes a very long time. And this is manifesting itself in very poor ways, and essentially has set up a two-tier system: those who can afford to go out of network and those who can't. And very few people really can afford to go out of network. And so this is a problem. Beyond that, I think most of the medications for mental health are actually being prescribed in primary care. And on the one hand, it's good that they're trying to be responsive to the needs of their patients. On the other hand, they aren't really adequately trained in this area. And so we're looking to integrate behavioral health in a more methodical way through a collaborative care type model into primary care, and trying to support those type of models. Technology can also play a role there with telebehavioral health and more remote type access. But again, there's a lot of work to be done to improve that system. On the other side, oncology is an area that there's been great progress made in terms of treatments and medications. The mortality rate has actually dropped by 25%. In mental health, the mortality rate has actually increased by 25%. So you can see the contrast there. What we're finding there is the need for our systems and our approaches to streamline so that we can kind of get to the right answer faster. And we've done kind of end-to-end assessments on how we are managing oncology and supporting patients with oncology through our plans, through our intermediaries, and as employers in terms of accommodation and return to work. And so I think the good news is we're making significant progress in improving our treatment of cancer, but I think we need to bring our processes and our policies in line with those advances.